Wood.
Good afternoon, everybody, and thanks so much for attending the webinar today. I think today, first and foremost, what we wanted to do as the Healthcare Authority is to really extend a huge thank you to all of our community partners who have been working diligently since October 1st, helping individuals and family apply through coverage through the Health Plan Finder. And we've had, as you know, some significant numbers of folks being able to enter and receive coverage in the Health Plan Finder. And we all know here that that would not be possible without all the hard work and effort that you folks have done out in the community. Just to give you an example, and I'm sure that many of you have been following the numbers that have been released by our partners, the Health Benefit Exchange, but on the Medicaid side of the house, the numbers really are pretty staggering. We have currently over 240,000 individuals enrolled in the new adult expanded coverage, and we've been able to enroll as well well over probably close to 300,000 individuals, family, children, and pregnant women into Health Plan Finder as well. Some of those are new individuals who have not received coverage in the past, and others are individuals who are going through and completing their renewals for the first time in Health Plan Finder. And we know that many of those enrollments are really due to your hard work. So we would first of all just like to give you all a big thank you for that. Then we also wanted to use today's webinar to kind of share with you, if you would, some lessons learned or some things that we are seeing happening in Health Plan Finder after we've had a couple of months here to see the system in action. And so we thought it would be a good opportunity to share those issues with you today. And we also thought it would be helpful if we had an opportunity, perhaps on an ongoing basis, to meet with folks maybe every 2 weeks. We'll see how it goes, and to have the additional webinars be very topic specific on those issues that you are having the most concerns with. And so as we move through the webinar today, if something comes to mind that you would like to have as a future webinar, we'd love for you to type it in for us. We'll also take some time at the end of the presentation to give you an opportunity to type in and enter any topic-specific things that you'd like us to cover in the future. And, you know, the possibilities are endless, so we can make those future presentations very specific and try to delve down into issues that, that you're running into as you help families on a daily basis. So today, what we'd like to cover is the following topics, and we're not going to delve into the specifics, but more look at areas where we're seeing things come through Health Plan Finder that we have some concerns about, and we wanted to share those with you. So we want to be able to talk about income, citizenship and immigration, residency, incarceration. We also want to share with you our renewals and some of the efforts and issues we've had around getting families renewed. And then at the end, we want to be able to provide you with some resources which we hope will be helpful in having you continue to work with families. So our first thing that we'd like to talk about is the insurance affordability. And as you know, in Health Plan Finder, we have a continuum of what we call insurance affordability programs, whether it be Medicaid or Washington Apple Health, tax credits, or QHP, full QHP. And as you know, if you've been helping families, there's a box on Health Plan Finder that says, do you want to apply for health insurance premium tax credits, cost sharing reductions, or Washington Apple Health? And that box in Health Plan Finder is defaulted to a yes. But what we have found, and we've received several calls, which is why we're kind of bringing it to folks' attention, that there are times when families go through the health plan finder and they did not want to apply for Washington Apple Health or Medicaid, and in fact they've asked us if we could close their cases. And so we just wanted to point that out, make sure that everyone was aware of that this field is always going to default to a yes, but that if you are working with an individual or a family who is only wanting a qualified health plan or who has stated that they do not want Medicaid, then that box needs to be changed to a no. The series of questions that you will get when that's marked a no is going to be much more streamlined because we don't need to ask questions about any of their income, but they will get a different result. If that box is checked yes, and the family's income is below the Medicaid standard, then they are going to be approved for Washington Apple Health. And as most of you, I'm sure, know, if a family is eligible for Washington Apple Health, then that's the coverage they must receive, and they cannot opt to just receive tax credits. So it's, they can opt only to receive a qualified health plan, but in that situation they'd have to mark no there, that they don't want either Medicaid or tax credits. This next slide just kind of shows you in the screen flow where you would see that. In this slide we've marked it no, but as a reminder that is always going to be marked yes. So just kind of keep that in mind as you're helping families. The next topic we kind of wanted to talk about was in regards to income, and what we'd like to talk to today, instead of getting right into specific incomes, is perhaps how we're looking at averaging or entering income on the screen. And there really are two ways, if you will, for putting in income for Medicaid, and that is if we're looking at what we call point in time for Medicaid or income averaging. So this next slide here talks about, or at least shows you, where you would enter employment income in Health Plan Finder and what that would look like. And then following on the next slide is where we're going to talk about point-in-time income. And for Medicaid, point-in-time income is really the income that an individual expects to receive in the month that they're applying for benefits. And so in this example here, this individual is applying in the month of February, and they anticipate from their earnings that they're receiving that they're going to receive $1,250 that month in income. And for Medicaid, they can enter that amount on that employment screen that we previously saw. Another way that families can look at, or individuals can look at entering their income, is by doing what is called averaging income. And that's when an individual can take a series of months, especially if their income varies from month to month, and they can take a series of those months, and in this example they took November, December, and January. They totaled up their earnings for those 3 months and divided it by 3 to determine what an individual's monthly income is. So as you're working with a family, you have the option, or the family has the option or choice, if you will, of determining their income using whichever method is more beneficial for them. So they can choose to use point in time, or they can choose to use income averaging. If an individual is self-employed, that individual then provides their monthly income after deducting the allowable business expenses. And you can do that a couple of ways. If an individual has not filed taxes, they can simply determine offline, if you would, their monthly income and subtract their business expenses for that month. Or they can take the amount that, if they've been filing taxes, that is on line 12 of their IRS 1040 form. The individual then, in this example, they were making $1,400 a month before taxes and business expenses, and they're showing business expenses of $400, so their monthly income would be $1,000. One of the things that we are seeing in self-employment as we're reviewing cases or getting calls from families is we're seeing that a common error is that individuals are not remembering to deduct their monthly allowable business expenses before entering their self-employment on their screen. And in some cases, this is causing families to become ineligible for Medicaid or Apple Health when they, in fact, are under the income standard. So as you're working with a family, it's important to note if they're self-employed that you do want to make sure that you deduct allowable business expenses before you enter that income on the screen. The next slide here is just a reminder to folks, and it's a general reminder of what is allowable business expenses, which is kind of helpful to keep in mind, especially if you're working with individuals who are self-employed. On the next slide, what we really wanted to talk about is whether someone is self-employed and you're entering their average yearly income from their self-employment, whether someone is employed by an employer, whether you're using point-in-time income or income averaging. As we talked about, you can use whatever method is most advantageous to the family. So in a situation, if you decide that averaging income is going to come up with the best income that represents the family's income, you can use averaging. When you do that and you enter that income into Health Plan Finder, what you cannot do, or what we are asking that you do not do, is that if you get a result from Health Plan Finder and it determines that the individual is over the Medicaid standard, what we cannot have happen is individuals going back in and recomputing income so that at a point in time it becomes under the Medicaid standard. So it is certainly within the rules and allowable for a family or someone helping a family to pick the income method that is most advantageous to them, be it point in time or averaging. But once you've made that determination of the methodology that you're going to use and you enter the income, it is not okay to continue to go back in and change income on the screen. And so if a family income puts them over Medicaid and they trickle or roll into tax credits, then that really is the program they're eligible for and the program that we want to see them receive benefits under. So on the next slide, what we'd like to talk about today too is to just kind of briefly review with you citizenship and immigration. And as you know, immigration has never been an easy thing, and it can be very complicated sometimes to understand someone's immigration status. But I think what's important to note about immigration for Medicaid is that the rules have not changed on immigration. So the rules that were in place for Medicaid prior to October are still in play today. And I think it's important to note that neither the exchange or the healthcare authority has issued any workarounds that would require you to change someone's immigration status and report it something different than it is. So what we need to do is correctly enter individuals' immigration status into the system so that you can receive a correct result. So if an individual is approved for Medicaid in error, and you believe that they're not eligible for immigration or for Medicaid due to their immigration status, we would really appreciate here at the Healthcare Authority if you would contact your Healthcare Authority area representative immediately. And at the end of the presentation, if you haven't received a list of the area reps, we have that available for you. We are working very closely with the Health Benefit Exchange, and we realize that in some circumstances there have been a few cases where individuals have correctly entered data into the health plan finder, and we've gotten a result that we believe is incorrect, and we're working on that. There's been work going on that this week to see what is actually happening there. But we would really appreciate to hear from any of you where you think that has happened on a case that you're working on. As a reminder, there are a couple of various different statuses for immigration. There are some individuals who enter the country who never have to serve what we call that 5-year waiting period. That's always been the case. So if an individual comes into this country as a refugee or an asylee, as an amerration, or someone who is a victim of trafficking or Cuban Haitian, they've been always exempt from the 5-year bar, and that still applies today. And so when you enter them, if they meet the income criteria, you would expect to see that they would be approved for Medicaid. There are some individuals who are not exempt from the 5-year bar and who must continue to serve that, and those are individuals who maybe enter as a legal permanent resident alien, and they're going to have to serve that 5-year wait period, just like they always have. And I'll tell you, this has been the case where just last week I saw a case, or actually two, that were presented to me where the system did seem to approve individuals who were in that 5-year wait period. So it's one of the reasons I wanted to talk to you today about that, and to ask for your help if you happen to see a case like that, to let your area rep know. We also have individuals who are considered non-qualified, and those are non-citizens who are lawfully present but are not considered eligible for Medicaid. And then we have individuals who maybe have no legal status currently here in the country, and those, as you know, are individuals who have who are eligible for our pregnancy and children's medical, but are not eligible to receive other Medicaid coverage. For the exception then to that 5-year bar rule that I spoke about has been the exception that's been in place for some time now, where if you are an individual who's a pregnant woman or you're a child, you are eligible for Medicaid even without that wait period. So we should see approvals for those. But if you are an adult who is not pregnant and you're in your 5-year wait period, we should not see those cases approving for Medicaid. Also, I just wanted to briefly go over, our team has been kind of working on coding, and we know that sometimes that can be difficult or a little more challenging in Health Plan Finder. And these next 2 slides give you some coding tips, if you will, for the various documents that you might have from someone. So if you're working with an individual or a family and they have an I-551, you would want to enter their A number on that card, their receipt number, and their date of entry. if you have an individual or families that have come to you and they have their passports, you would want to enter their passport number, their country of issuance, their date of entry, and their document expiry date would be the fields that you would enter. If you have an individual then, and they're presenting you an I-571 document, you would want to put the date of entry and the A number on that. And then for all others, if none of the above information status documents are available, then the individual or you on their behalf would select other, and you would then enter their date of entry, their immigration type, document type, and their A number. I guess the most important thing off of these slides is we'd appreciate you helping us be our eyes and ears over these next couple weeks as we work to figure out if we have an issue with our immigration. And again, if you see a case that you're concerned about, please feel free to follow up with your area rep on that. Finally, on our last slide on citizenship and immigration, I want to note that those who are applying for medical or who declare that they are not legally residing in the U.S. Will not have their information shared with Homeland Security. So as you know, we've always said that, and that still remains the case. If an individual is not applying for medical coverage, or if they mark that they are not legally residing here, nothing is going to go up to the federal hub. We kind of hear anecdotally, we're not sure if that's true, where families are still kind of concerned or anxious about that. So any help that you can give in sharing that information out to families would be appreciated. The next kind of topic that we wanted to discuss today was residency, and again, the rules on residency have not changed for Medicaid. They're still the same. Individuals, we have seen instances, however, where we have seen cases where individuals are being approved for Washington Apple Health when they have an out-of-state physical address. And so we just wanted to make it very clear to folks here that the rule hasn't changed on that. If someone enters Washington State just to receive medical care, they are not considered a Washington State resident. And the individual would not be eligible for Washington Apple Health and Medicaid. And so in those cases, you would want to clearly mark on the question where it says, are all household members on this application residents of Washington? You would want to enter that no. Sometimes in Washington here, especially since we have some large regional, if you will, hospitals, it is possible for someone to have been flown into Spokane or flown into Seattle to receive coverage, but their home may be Alaska, or it may be Idaho or Oregon. In any of those cases, if the individual is here just to receive health coverage and their home, their residence is in another state, they are not eligible for Medicaid, even if the other state is not offering the new expanded adult coverage. So it does vary from state to state. And even though adult coverage may not be offered in the state they live in, they're not eligible for Medicaid, and those questions would be, that question would be, have to be answered no on that. Again, just as a reminder for residency, there's no period of time that someone has to live in Washington to be eligible to apply for benefits. They just need to intend to live in Washington, or they entered the state looking for employment, or they entered the state because they had received current employment. So It's not that someone has to live here for 60 days or 90 days before they can apply, but they do have to be residing in Washington to get coverage. We wanted to talk briefly about incarceration. Again, this is a rule that has not changed. Individuals who are incarcerated at the time that they apply for coverage are not eligible for Medicaid, and the health plan finder would correctly deny someone in that status. There are some exemptions to this rule that some of you may have heard about, and so we thought we'd take an opportunity to share with you. We've been working with Department of Corrections and with some of our city and county jails. If there is an inmate who must go to the hospital and receive inpatient hospital care, CMS has provided guidance that we can provide Medicaid coverage for that inpatient hospital care as long as the inmate meets all other eligibility requirements for the program. So you may see or you may hear, especially if you work in a hospital setting, you may hear about if an inmate is brought in, there's a very good likelihood, since they are incarcerated, that their income will be under the new adult group and they would be relatable to the new adult Medicaid coverage group. In those cases, both whether it be a city, county jail or DOC can apply on behalf of that inmate for that inpatient hospital stay. But once they've returned to the prison or jail, their coverage is ended, and the only thing that can be billed to Medicaid is that inpatient hospital stay. We have also been working with DOC and some of our city county jails who are interested for some inmates to be able to do kind of a pre-release, if you will. And so we're looking at and have set up memos of understanding where they can do up to a 30-day pre-release so that when the individual leaves the facility, his Medicaid will be up and going and he'll be eligible for coverage. I think it's important to note that this is only true for Medicaid, that for the exchange, if an individual is incarcerated and the only benefits that they're eligible for are tax credits or QHP, that they cannot apply until after they've been released. I think on this next slide I probably yammered on and went through that already. It's just kind of a repeat of what I had just talked about there. Finally, the last kind of major topic that I wanted to share with you today was a little bit about our renewals. And again, this would be another area where we would like to continue to ask for help from those of you who have been working with both individuals and families. We have been working for our renewals. Families during this first year, we've been asking families to transition their case over into Health Plan Finder at the time of their renewal. And so what we have to do over this year of 2014 is transition over all of our existing family, children, and pregnancy medical cases. And we've been doing that at the renewal time. And the first renewals that we started doing this with were November of 2013 renewals. And we have not been as successful in getting families to come in at renewal time as we were hoping. And we are sure that there's a lot of reasons why that may be. Some of them were certainly the challenges of the system in the first couple of months of implementation. So we're asking today, as you work with families, if you're helping a family, we would ask that the first thing that you do is ask if the family you're helping with, if it's time for them to renew their case. And if it is, if you go in and you search in Health Plan Finder under the primary applicant's name, what you should see there is the box should come up that says Renew My Coverage on their individual dashboard. And if you click on the Renew My Coverage, what it will do is it will have pre-filled the family's demographic information into Health Plan Finder, which will make it easier for them to complete their application, and hopefully easier for them not to come across some of the errors that you may see as you're helping families, because their demographic information is already there, so it will match up perfectly with ACEs. If you're working with a family who maybe is coming in and perhaps they've already lost their coverage, maybe they were a November or December renewal and their case did not get renewed, we ask that if you can help them submit their application in Health Plan Finder, that would be great. If so, while you're submitting that application, if for any reason you get an error or an issue with it, we ask if you can send an email to the Ask Maggie box that's here on your screen. And in the subject line, if you could enter renewal and then put in the primary applicant's name and date of birth. If you can do that, what we'll be doing here is ensuring that their coverage is continued. So either way, we can get the family through, but if you have the opportunity and can enter that for them, that would be helpful. Karen, before I go to research, maybe we can go back. I just wanted to add one more comment to folks. As many of you might know on the phone, what we've been doing to try to help families with renewals is we've extended benefits for 1 month for November, December, and January. We will not be extending benefits for our February renewals. So family members who had a February renewal, if that's not completed, their case will close at the end of the month. What we will continue to be doing for families is, and what we did for November and December and January families is we did send an additional letter to them notifying them if they wanted medical coverage and for whatever reason it had not been able to complete their renewal, if they could contact us and provide us their name and birth date, that we would continue their medical benefits for them and work with them to get their case entered into Health Plan Finder. We are going to, even though we're not going to extend February benefits for an additional month, we are going to continue to send that follow-up letter to all the February individuals that did not get their renewal completed. And we'll be letting them know that if they want to call us, and on the letter will be a number to call the healthcare authority, and they'll have the opportunity to reach either a live person or if the wait time is longer than 2 minutes, to leave a voice message letting us know they want their renewal continued. They'll have the opportunity, if they don't want to call, they'll have the opportunity to send this renewal notice to the Ask Maggie box on your screen. And then finally, they'll also, if they would rather, they'll have the opportunity to tear off the bottom of the letter and enter their name and birth date and ID number if they have it. And we'll also enclose a prepaid envelope for them to send that back to us. So we are hoping that families with those 3 options If they've not been able to get into Health Plan Finder for whatever reason, that they will notify us in one of those 3 ways, and we will continue their benefits for them. So hopefully that's helpful for you to hear that information, and as you work with families, you can maybe assist them in letting us know that they want their coverage continued. On the next slide then, we just wanted to go through a couple of referral items for you, and you may already have those if you've been partnering with us for a long time, but if you're someone who's just started with us, you might find these very helpful. After the next couple of slides here, I'll give you the address where you can go in and download these at any time. But we do have a customer service center referral list that kind of lists the various call centers, if you will, and some of their key functions. And it also gives you the contact information, both email and phone, for each one of those various call centers. So sometimes that's helpful to have if you're not exactly sure who to call. On the next 2 slides is a list of the healthcare authority area reps that I alluded to earlier. And these individuals are there and available to help you kind of in 2 specific instances. One, we ask if you have a case that you are trying to get through Health Plan Finder and have been unsuccessful in doing so, and the family has a medical emergency or need, we ask that you either call or email your area rep and let them know about that, and they will work with you as quickly as they can to help get those cases through. We also ask, earlier today I asked if you're seeing cases where you have concerns on the immigration, or whether someone's case has been determined correctly, that you contact your area rep, and these would be the area reps that you would contact. So each county has a specific rep, and you can give them a phone call or drop them an email. Both of the resources that I gave you there, the Customer Service Center chart as well as the area rep information, all of that can be found here at our main website for the Healthcare Authority Medicaid expansion. You also can find our training and education site off of the expansion website. And in particular, I wanted those of you who maybe did not have the opportunity or at that time didn't feel that you would want to have enhanced access. The Healthcare Authority has partnered with lots of various community partners. And in September, we provided a great deal of training, and at the end of that training, we gave folks the opportunity that if they would like some enhanced access to Health Plan Finder, if they completed the training, signed the agreements, confidentiality agreements, and completed a Washington State background check, that we would be able to give those folks enhanced access, and we've done that. What enhanced access means is it does allow you things like being able to help individuals get past the ID proofing screen, and it also allows you to kind of follow back with the family for up to 30 days. This enhanced community partner access would still be available if there are individuals listening today who would like to receive that access. You can go to this training and education website. We have online a series of, is it 6 training modules? There are 6 training modules on site there that you can take. Once the modules are you can take them at your own time and at a time that works for you. And once you've completed all 6 modules, it gives you the information. You'd actually be contacting Karen, but it gives you the site at which to contact her at. She'll send you out an assessment, and once you've taken that assessment, you'll then be given, she'll send you out information for the confidentiality statement and the Washington State background check. If you mail that information back to us, we'll complete the background check for you. And once that's all been done, Karen will work with you to get you your enhanced access. So if anyone is interested in doing that, the details about that are on the training and educational page here on the screen. And we would be happy to work with you in getting you that enhanced access. So Karen, I think we're right about at the spot to stop for questions. And then after we take a few questions, what we'll do is give you an idea about some of our future webinars. And this might be a really good time, too, as we're taking some questions. If there is anything that you would like to have a specific webinar on, be it something more specific on really how do I budget income, where we could delve into it in more detail. If it was more specific training on immigration, if there's things, and we work very closely with our partners at the Health Benefit Exchange. If there's specific topics on perhaps some paying of premiums or information on that we can share, we can certainly work with Health Benefit Exchange and gather them and can ask them to come participate as well. So as we're kind of taking the last questions and wrapping up, if you can enter anything that you think you'd like to hear in a future webinar, we'll try to put that together for you. So Karen, do we have any questions that we'd like to? Probably have more than a few, huh?
We do have quite a few. Okay. Let's see here.
So let's see, we'll start maybe here at the top. There's a question here on skilled, skilled nursing. Did I see it here, Karen?
Hold on. Just a moment.
Sorry, guys, there's quite a few here. I want to try to get. So there's a question here that says, what is the turnaround for the Ask Maggie? And I think it's the Ask Maggie mailbox. You guys, I'd like to say, and I want to, I want to be as fully transparent as I can. We're trying our best to keep up with the Maggie questions, and as well, the reps are trying to keep up with the emails that they receive. I would say we would try to get to those as quickly as we can. Again, I would stress, if you have an emergent case, if you've entered something in the Ask Maggie and now the family is following back up with you and they're needing care, please contact your area rep on that.
Another very common one was requesting retroactive coverage.
Oh, you guys, yes, retroactive coverage is still available, and I know that I'll be honest with you, our main focus has been at the MEDS office, has been on getting individuals eligible for current eligibility moving forward. But we do have a report that has captured all of the retro requests that have come through Health Plan Finder. And so we are setting up a process to work through those. If you have someone where, because the retro request has not yet been worked and someone is concerned about a financial issue, maybe with a hospital or a provider because the bill is past due now, if you can let us know or let your rep know, we'll be sure that we get those worked quickly for you. Here's one on should we do this? Someone here has asked if someone is looking to apply for health insurance but does not meet the 5-year bar. This person is a permanent resident and over 65 years old. So where does he or she need to go to apply? If all of the members, is kind of a two-part question, if you will. If all of the members in the household are over 65 or on Medicare, in almost all circumstances, unless they're taking care of a young dependent individual, they're going to apply and have their application taken care of by the Department of Social and Health Services, just like they did prior to the health plan finder coming into existence. If an individual is only eligible for Medicaid and they are over and they are having to serve their 5-year bar, they're not going to be eligible for Medicaid. What we could look for in this particular individual, if they're over 65 and not on Medicare, they may be able to purchase tax credits if they're legally residing, and so they may want to come to the exchange and have their case looked at for that.
Do clients who are applying for DSHS long-term care programs need to apply through Washington Health Plan Finder or Washington Connection?
The best place to apply if what you're wanting to receive, and again, if everyone in the home is over 65 or on Medicare, the best place to apply if you're applying online would be through Washington Connection for those individuals.
How will we know that a retroactive coverage has been processed?
The family is going to receive, when it's been processed, they will receive a letter in the mail letting them know which month they were approved for and that it was approved. That coverage then, once that is approved, if the person who's asking this question is more of a provider, once that is approved, you will see that retro coverage in Provider 1.
What is the difference between an in-person assister through Health Benefit Exchange and an healthcare authority community partner with enhanced access?
It's a good question. The in-person assisters through the Health Benefit Exchange have received a broad array of training, more extensive training, and training that has to do not only with the enrollment process into Medicaid, but also into selecting plans and payment through Health Plan Finder for plans. So they have a broader training. The enhanced access the enhanced access that we offer for our community-based partners was really geared at helping our Medicaid families and individuals, if you will, to get into the system. So it's really geared more towards Medicaid, and the access that we've given them, like the ID proofing, help with ID proofing, is all geared on helping, if you will, families get into Medicaid coverage.
What is Washington Connection?
Oh, I'm sorry. Washington Connection is the online application that is managed by the Department of Social and Health Services, and it is used for both to apply for public assistance benefits, including cash and SNAP or food benefits, as well as our classic Medicaid programs.
Okay, let's see. Will copies of this presentation be available? And I can answer that. We are recording the session today, and so a copy of both the slide deck and the recorded presentation will be located on our website next week. And we'll send that out to folks when it's available.
And I would say, guys, I'm looking at the questions. We've received so many questions. What I would like to tell you, what we would like to do is we will use these questions that you've sent today, which we cannot answer all on the phone, to help along with your suggestions of future topics, and we will use these to kind of build our future presentations. So, I mean, these are all really good questions. I just don't think we have time to get through. I know we don't have time to even get through a partial group of them. So, Karen, is there one more we can do? And then, let's see.
What is the best way to help homeless minors apply for coverage?
Oh, really good question and timely. And I'm hoping, not hoping, we'll have it done by the time we do another webinar in 2 weeks. We're right in the middle of trying to finalize a process for our homeless teens. As you know, if you work with homeless teens or anyone who's under the age of 18, to get your application to process, the system will say that you need to call the Health Benefit Exchange call center. We're working with the Health Benefit Exchange and also with our community partners that in particular work with homeless teens. We're trying to put an additional resource on that here at the Healthcare Authority. And so we're just kind of finalizing that. So in the future, you'll kind of have two options. One, you will always be able to continue to call the Health Benefit Exchange as you can do today. But if that line is busy or not available, we are also going to make available a contact person here at the Healthcare Authority as well as their email so that you'll be able to kind of work directly with them to get those teen applications through. So more to come on that. And Karen, as we kind of do this and these things come up, we'll be able to send this information out to everybody.
Or you mean specific handout?
Yeah, or topic. Yeah, yeah. So what we'll do is because that really should be finalized. We're hoping next week, you guys. So we'll send something out on that to everyone, and we'll hope that makes it a little easier for folks.
So what I'd like to recommend is that each of you, if you check the HCA area representative list, and it's by county, and if you email your representative, you can be added to their email distribution list, and then you can receive a variety of updates on a weekly basis. So that's what I would recommend to stay in the loop.
And if you're already connected with them, you don't have to resend them. They'll automatically send that out. So that's just if you've not been connected with your area rep. So I think. Oh, we got.
Can you remind me how to request retroactive coverage for pregnant women and children?
Yeah. When you go into Health Plan Finder, or if you complete the paper application, there is a box or a question that says, do you have unpaid medical bills in the last 3 months? If you check yes to that, either on the paper application or electronically in Health Plan Finder, that request will be captured and we'll be processing those.
What about college students who reside with their parents in Washington State but are temporarily going to school in another state?
Are we talking about them for Medicaid?
Yes.
So if we're talking about it as related to Medicaid, your residency is the place where you call home, so you would be considered a Washington resident. Sometimes if there's questions on that or students have been gone a long time, one of the things we ask is, are you paying out-of-state tuition? If you're paying out-of-state tuition, then you're still a Washington resident. So, and if there are folks we're still claiming them as tax filers, then we would as well continue to, as a tax dependent, we would continue to look at their parents' income in determining their eligibility. So you guys, for our future webinar then, the next one we'd like to try to do, and I think Karen has already sent out a notice for you, is February 27th. What we plan to do, the registration, announcement was just sent yesterday. And what we're going to do is really take these questions that you've given us today and any other suggestions that you've had, and we'll try to package these into either one webinar or maybe a couple, because there's quite a few questions here, and see if we can work through these and give you some real-time answers for some issues that I know you've been struggling with.
Okay, the webinar is now complete. You may end your